Good afternoon, everyone. We have assembled here to celebrate World Day for Safety and Health at Work through national webinar organized by National Atlas and Thematic Mapping Organization, Department of Science and Technology, Government of India. It is a part of the year-long celebration of the 75th year of independence of India. World Day for Safety and Health at Work, which is also known as International Workers' Memorial Day, takes place annually on April 28th. This day is an opportunity to highlight the preventable nature of most workplace incidents and to promote workplace safety. The COVID-19 pandemic has led governments, employers, workers to face unprecedented challenges in relation to the virus and many effects it has had on the world of work. The pandemic has touched nearly every aspect from the risk of transmission of the virus in workplaces, shifts to new forms of working arrangements such as widespread reliance on teleworking. It has also triggered psychosocial risks. UN recognized this day to be officially celebrated from 2002. It is concerned about safe work and awareness of the dimensions and consequences of work-related accidents and diseases. If you look at the statistics, one worker dies every 15 seconds worldwide and 6,000 workers die every day, which is very much alarming. Hence, this day is of utmost importance. This day is celebrated to improve workers' health and safety by eliminating accidents, pursuing a better working life, and creating a safe and comfortable working environment. This day is acclaimed in world and very much important to discuss as the well-being of the workers is very much important for the production and for the economy as well. So it is sometimes a responsibility of the organizations to look after the well-being of the workers. The well-being of the workers is very much of our concern nowadays, as after the pandemic, all the levels of the employees and the workers are exposed to threat of the virus spread, and also it is affecting their physical and mental well-being as well, because there is also always a psychosocial risk among them and they are feeling threatened to come to workplaces. Today we have an important topic that concerns the focus is on the mental health. As we know that we are always concerned with the physical well-being, but the mental well-being is sometimes ignored because it is very much difficult to find out whether a person is mentally well or not. So for a proper functioning of any organization, the workers has to be fit physically as well as mentally, because without mental well-being, the physical performance also suffers. Hence, this is a very important aspect of the discussion that we are about to take part in, that how much mental well-being is required for any organization or for the workers. I welcome our respected director, Madam Dr. Taputi Banerjee, to share a few words with us on today's occasion.
I thank you to all the participants. Uh, Good afternoon. And first of all, I welcome all the participants present over here in this day of 28th April to celebrate World Day for Safety and Health at Work. As you know, we have initiated the series of special lecture program as a part of 75th years of India independence, that is Azadi Ka Amrit Mahotsav. And the celebration of this day is also a part of this program. I welcome all the members outside NATMO who were present over here, and I welcome all the officials and staff members of NATMO. I especially welcome our special guest, Dr. Anuttama Banerjee, an eminent psychologist, Her gracious presence today in this platform, feeling us proud, obviously. Her knowledge and experience sharing, of course, it will obviously enrich ourselves. Following the COVID protocol, the program has been arranged in virtual platform. Friends, we all want to be safe throughout our life, right from morning off the bed to night on the bed, in our home, on the road. When we come out from home, we all see, or everybody of us used to see every vehicle in front of us runs with a tag, safe drive, save life. Similarly, we try to be safe in our workplace, especially under COVID pandemic. International Labour Organization, that is ILO, estimated that every year about 2.3 million workers die from work-related injuries, which is very much common in the unorganized sectors. And an additional of 160 million workers suffer from non-fatal work-related diseases, and 313 million suffers from the non-fatal injuries. So this is usually it is more in the developing countries, as different sectors like construction, power supply, mining, agriculture, etc., etc. And even in the last few months, especially during Amphan's, I think that we know that we came to know from the news media that the incidences of health and injury about the workers working in the high tension line when injured and that the death occurs. We don't know exactly the exact figure out of these regular incidences. Under this COVID situation also, we lost several warriors working in the front line of health department, be it in the government and non-government sectors. So ILO, they were started this program in the year 2003 to promote safe, healthy and safe work, capitalizing on the ILO's traditional strength. The day provides an opportunity to reflect on how to prevent work-related occupational diseases, deaths, injuries, and illness. This day is also remembered for those who have died in their workplaces related to work-related injuries and illness. This year, the theme set by ILO is anticipate, prepare, and respond to crisis and invest now in resilient occupational safety and health systems that acknowledges the impact that the global COVID-19 pandemic has had on our working lives and the importance of building an effective, resilient, and adaptable work health system framework. World Health System Framework. Occupational safety and health is a cross multidisciplinary area concerned with protecting the safety, health, and welfare of people engaged in work or employment. So work safety and occupational safety and health protect the co-workers, family members, employers, customers, and many other related who might have affected by the workplace environment. So national occupational safety and health culture to work in a safety and healthy environment is in respect to the all levels, and it is respected also where governments, employers, and workers actively participate in securing a safe and healthy working environment. Through a system of defined rights, responsibilities, duties, and where the highest priority is accorded to the principle of prevention. So without any elaboration today, we will listen from Dr. Anuttama, an eminent psychologist and very well-known face in the electronic and print media. We are thankful to Dr. Anuttama, who has agreed to spend some time with us by sharing her knowledge on ensuring emotional safe space at work. So I request Srimati Shreya Bhattacharya to invite Dr. Anuttama Banerjee to deliver her lecture. With this, I again thank you all to be here to listen from Dr. Anuttama. Shreya, please.
Thank you, ma'am, for enlightening us with your informative speech. I cordially welcome our honorable speaker, Dr. Anuttama Banerjee. She is not only a renowned psychologist, but also academic mentor, poet, and columnist. She is attached to Medica Super Specialty Hospital and Crystal Mines as a consultant psychologist. She has done her PhD in clinical psychology from Calcutta University. She has completed her personal training in psychoanalysis from IPS Kolkata. She extensively works in the area of gender and sexuality. Her opinions on various psychosocial issues are often highlighted in both electronic and print media. Her columns address both personal and collective journeys through the lens of psychology. She is a well-known personality in the area of mental health. She has been awarded with Kriti Sahitya Samman Award for her poetry books in the year 2020. Welcome, ma'am. We are eagerly waiting to hear the topic you have chosen, ensuring emotional safe space at work. Please, ma'am.
Okay, thank you so very much, Shreya. And I would like to thank Dr. Banerjee for the introductory speech that was really, really helpful. It has actually sets the tune for me. Yeah, it has sets the tune for me, ma'am, to carry on. I would like to thank Madhu Chanda, who actually initiated this conversation between me and National Atlas and Thematic Mapping Organization. I actually thank all of you for being here, and let us try and strike a different dialogue where we can ensure emotional safety. So I would begin with this word emotional safety. Perhaps this is high time that we reflect on the word safety, because the safe environment, physically, health wise, emotionally, uh, is quite some an issue at this point, particularly when we are struggling with the pandemic situation. We are hit by the second wave. The whole country is struggling. Kolkata is struggling. West Bengal is struggling. The other states are also struggling. So I think we are more or less on the same boat, and we have to sail through together. So at the workplace, when we are trying to ensure emotional safety, first we have to understand that we used to come back from work. Now work has come back with us. We are constantly with work at home, and we also have work in home. So that's a major challenge for many of us. And sometimes this load is slightly gendered, particularly for women. We know that the domestic works, the domestic issues, at the same time, the work from home, we have to balance, and that creates added burden to many of us. So let us try to look into all those factors. But prior to that, I would just introduce the basic concept of emotional safety. What is emotional safety? And then we would try and see that at this point, in this context of COVID, how can we ensure emotional safety at the workplace? The basic concept of emotional safety at workplace basically started with Amy Edmondson. We more or less know about her, I'm sure. If you are still not aware of her work, you can search in Google. Her more or less her works, the PDFs you will find in Google. So the basic concept of emotional safety at workplace says I should feel safe while being myself, while saying what I say, while doing what I do. And I must know that they will not be held against me unless I have intentionally harmed my organization. I would repeat. I should feel safe to be who I am, to do what I do, to say what I say. I should know that this will not be held against me unless this is intentionally done to harm the organization. Now, this is the primary context of emotional safety. Now, let's break this definition. Let's try and understand what does it exactly mean. So, when we say that I should be who I am without feeling threatened, without feeling unsafe, this is directly related to the concept of diversity. Perhaps I'm a person who does not speak the language of most of the people around me in this organization. Or maybe I have a certain religion which does not go with the majority of my team members. Or I come from a gender sexuality orientation which does not go with the other members of my organization. I must not feel excluded. I must not have the need to hide myself just because I'm different. That is the primary criteria of emotional safety. Secondly, things that I'm saying, things that I'm doing, will they go against me if I'm not intentionally harming the organization or the individual? Now, let us explain this part. For example, when we are making some task related decisions, for example, we are holding a meeting, we are conversing with each other. Maybe I have an innovative idea. Now, I should have the safe space to voice it, even if it is different from others. The difference tolerance is extremely important for ensuring emotional safety in the organization. Difference, disagreement is not the same with violence. If somebody comes up with a new decisional, new ideational context or new ideational project, let us give that person a patient hearing. That person should know that this will not be held against me because I did not intend to harm the organization. My intention was not to sabotage the project, but I thought it would benefit. I thought it would help. So, this interpersonal trust should be there. The leader has an important role to play here. The leader should create an environment to listen patiently the ideas. Then the idea can be rejected, then the idea can be retained. The person who is sharing the idea should also know that my ideas would be taken in a very fair ground. Just because my last idea was rejected, this one too will be rejected is a sense of unsafety. We often have that. Sometimes we feel that, I'm not liked by my leader, I'm not liked by my boss. So no matter what I say will be rejected. That means I'm not feeling emotionally safe in my organization. And it is the duty of the leader to ensure that fairness in the organization. That I may not even like you. I may even have scolded you yesterday for what you have done, but today, if your idea is good, I will appreciate, I will take it. Another very important thing is when we are executing certain functions, even there could be certain problems, there could be certain errors. Now, if we know that error was not intentional, we should have a safe environment at work that the person will be able to own it up. We would not create a scenario. Of course, we can tell that person that, well, this is not done, we don't appreciate it, but this should not go entirely against this person. There should be system of warning. The HR manual should clearly specify which are the behaviors that are not tolerated in the organization, so that the employee can't say that I did not know. So you must know what is expected out of you, and then if you deviate intentionally, that might go against you to an extent, but it must not be done in an unfair manner. That's very, very important. In this COVID scenario, I will divide emotional safety in workplace by, creating two regions. One is task related safety, another is interpersonal safety. How can we ensure task related safety? Error tolerance, to what extent will be done, what are the errors that we would not tolerate, that is something the leaders will have to sit and decide together. Sometimes we have to also ensure that I would push my team members to go beyond their comfort zones. স্যার আমার ভুল হতে পারে, ম্যাম আমার ভুল হতে পারে, হ্যাঁ হোক আমি আছি, তুমি তাও চেষ্টা করো. This is pushing somebody beyond the comfort level. This is very, very important, because if I do not have the confidence to make mistake, I will not move, I will not grow. So the leader creates the environment that I know that you're not intentionally doing it to damage the product, you're doing it for the benefit, I'm there. And it is very, very important, the leader will also say that if you mess up, I'm there because I knew that you intended to do good. I will take it up. The whole team's discredit It's my discredit, but I will not name one particular employee. I will not hold it against that one particular employee. If we can ensure it, তাহলে দুটো জিনিস হতে পারে। একটা হচ্ছে আমরা আমাদের কমফর্ট লেভেল পুশ করবার কনফিডেন্স পাবো। সেকেন্ডলি, আমি কোনো ভুল করলে সেই ভুলটা অন্যের ঘাড়ে আমি চাপাবো না। I will not project my mistake on others. I will come to my authority figure and I will say, ma'am, hands down, আমার গন্ডগোল হয়েছে, আমি ভুল করেছি, it's my mistake. এটা বলার সেফ স্পেস আমরা ক্রিয়েট করতে পারবো যদি আমরা তাকে এই কনফিডেন্স, এই ট্রাস্ট দিতে পারি যে তুমি যদি ইন্টেনশনালি আমায় ড্যামেজ করার জন্য কোনো ভুল না করে থাকো, কাজ করতে গিয়ে যদি ভুল হয়ে থাকে, আই এম দেয়ার টু লিসেন টু ইউ, আই এম দেয়ার টু গিভ ইউ অ্যানাদার চান্স. Intentional mistakes are different. For example, I can say from my area of work, say if I know that confidentiality etc of my clients whom I see in my chamber is something that I have to protect, like my ATM numbers. Now I cannot break that. If somebody else asks me about my client, I'm not supposed to divulge those information. If I'm divulging them, then of course it should be held against me. তার জন্য যদি আমাকে আজকে চেম্বার থেকে তাড়িয়ে দেওয়া হয়, আমার কিছু বলার নেই, কারণ আমি প্রাইমারি এথিক্স ভায়োলেট করেছি। আমি যদি আজকে একটা ইনকাম ট্যাক্স অফিসে চাকরি করি, সেখানে যদি আমি ঘুষ খাচ্ছি এটা ধরা পড়ে, আই মাইট লুজ মাই জব। এইখানে কিন্তু কেন আমার সাইকোলজিক্যাল সেফটি দেওয়া হলো না আমি বলতে পারি না, বিকজ দিস ইজ দ্য প্রাইমারি প্রেরিকুইজিট that I would not do something to violate the work ethics, the work culture, the work flow, the work process of my organization. But if I tried incorporating a new idea, I tried taking a new initiative, I thought this would work, maybe it did not work, that should not be held against me. Here, I must make another concept clear. If I do not have the safe space to take initiative, the organization will never take another leap, will never grow. আমরা যখন ছোট থাকি, একদম শিশু অবস্থা থেকে যখন আমাদের প্রথম ইনিশিয়েটিভ নেওয়ার জীবন শুরু হয়, ইনিশিয়েটিভের সঙ্গে আমাদের আরেকটা ইমোশন চলে আসে, সেটা গিল্ট। কাজ করতে গিয়ে যদি ভুল হয়, এই ভেবে যদি আমরা কাজ এট অল না করি, then the whole individual will be in a limbo state. Even that is not good for the organization. That's not good for the leader either. So we have to create the environment so that we can push the boundary. Maybe we can do it thread by thread, gradually, but we have to try to push the boundary. The leader will also have to ensure that. But at the same time, we have to decide certain boundaries and norms where we would tell our team members which kind of errors are tolerated and which kind of errors are kept at zero tolerance. So that once that zero tolerance level is violated, we should know that, well, actions might be taken against me. And in that case, we must not feel bad. Also, we must not take it personally. Task related safety ক্ষেত্রে আরেকটা কথা খুব বলা দরকার, আমাদের যখন disagreement হয়, there are times when we take the rejection personally. We must not do that. When we are having a conversation, maybe we are holding a board meeting, we are coming up with ideas. I must know that if my idea is rejected, it's not because me, Anuttama, why my idea was rejected. I must not take it personally. Me, Anuttama, is not being rejected. One particular idea is being rejected because maybe somebody else's idea was better in this context. I must not take each and every acceptance or rejection so personally. That's also another rule. Now, the most important part, interpersonal psychological safety, emotional safety. I would rather elaborate this because at this point during COVID scenario, also when we are working from home, this is a very, very important area. Now, what makes us feel unsafe at an interpersonal level? When we go for the work of Amy Edmondson, she has mentioned that it's all about feeling safe about interpersonal risk-taking behaviors. Now, when do we feel that interpersonal risks are taken? I can feel safe or unsafe about being vulnerable. I can feel safe or unsafe about being diversified. So these are the two very, very important elements. Maybe I have somebody dying at home, yet I have to do work from home. Maybe while holding a meeting, a phone call comes and I feel like crying. I'm switching off my video. If my other team members can understand, or if somebody knows that something is happening in my home front, somebody is not well, we should have the emotional network protective system to give a backup. Maybe we can give a private chat box open and we can write there that take a break. I will do your job for the time being. Just get yourself together and come back maybe after half an hour. We are there to give a backup. This is extremely important at this point because many of us are struggling with that. Many of us are having to deal with losses, mourning. At the same time, we have to meet deadlines. Many of us are waiting for our own COVID results to come, yet we are holding a meeting. Maybe while holding a meeting, I see the message that somebody is COVID positive. Maybe I am COVID positive. And I also know that after this meeting, I have to make the logistical arrangement. Trust me, it's not easy. It isn't easy. So, there, my other team members will have to create the emotional safe space for me to break, the emotional safe space for me to confide in. That's extremely important. আরেকটা জায়গা যেটা খুব দরকার এখানে আমাদের মাথায় রাখা, আমি যদি হঠাৎ একটা মিটিং এর মধ্যে আমার চোখে জল এসে থাকে বা আমি যদি অফিসেও থাকি, মেবি আমার একটা খবর এসছে and I broke. I'll just share one example with you. I know about a friend of mine who once lost somebody very dear to him. He leads an organization. His eyes welled up. He was about to cry. And in that moment, there was another employee who works under him was there. She just came up to him and just stood next to him. But this vulnerable moment did not spread in the organization. That's emotional safety. Nobody else knew that he broke in front of another junior member. This is emotional safety. You are safe me in my organization, even if I declare with a microphone, that does not make my employees feel safe. You have to walk the talk. I have to feel safe because when I broke, when I was vulnerable, that was not circulated. I have to be ensured. That is ensuring emotional safety. Or maybe at one point, I started confiding about my family conflict. Maybe one is going through a terrible breakup, and maybe she talked about it with somebody in the office. পরশু জানতে পারলাম সবাই সেটা জেনে গেছে. No, this is not emotional safety. So we have to create that non-judgmental space, that safe space, so that at this point, when we are all struggling with our emotional difficulties, at the same time when we have to earn our bread and butter, we should stand next to each other. We should create an environment where we can be empathetic towards each other. I would share quickly certain modes which are very important to create this empathetic communication. Firstly, empathetic communication এর একটা ফার্স্ট জায়গা হচ্ছে যে আমরা যখন কারোর সাথে ডিফারেন্সেও যাব, we can start with হ্যাঁ তুমি যে পয়েন্টটা বলছো this is good, এই জায়গাগুলো ভালো, start with acknowledging something positive, and then you must say but this is the area where we may have a limitation. So try this yes but technique. First acknowledge the positives, because no matter who comes with what idea, there will be some positive in it. It cannot be entirely rejected, because that way you can make the other person feel included. Inclusivity is extremely important. So say that okay, I really appreciate this part of your idea, but this is where executionally we may have some problems. So how about incorporating another approach to kind of create another edge with the idea that you just shared? So this way we can say yes, yet we can incorporate the differences. Number one. Second thing about empathetic communication is, when somebody is sharing a problem with you, do not invalidate the problem, do not invalidate the emotion. Extremely important. Let's say a friend of mine yesterday was crying and telling me that she has lost her pet. But she was also telling me that I could not say that to my organization because people are dying. How would they understand what my pet meant to me? This is the fear of being invalidated. This is the fear of feeling unsafe about being vulnerable with my emotion. Now, for her, her pet was like her child, and I know that. In that case, she should have the emotional space, at least with some people. I'm not saying with all the team members of the organization, to say that, I am just feeling so vulnerable because this is what had happened at this point. This is emotional safety. And when she's saying that, if she's confiding in me, I must not say, Manush morche, ar tuই একটা কুকুর মারা গেছে বলে কাঁদছিস? This is terrible. Trust me, this is how we invalidate the emotion of the other person. Even if you cannot empathize at that point, I would request everyone to please mute their microphones because it kind of interferes with the sound. Once I'm done, I will take the questions and then you can unmute your microphones. Thank you. So when we are talking to somebody, when they are confiding in us, when they are talking about their vulnerabilities, even if you cannot relate to them, তোমার যদি মনেও হয়, আপনার যদি মনেও হয় যে এটা আবার এমন কি সাংঘাতিক ইমোশনাল ব্যাপার, এ আবার এমন কি হয়েছে, please don't say that. Acknowledge the emotion. It is important to that person. Third, do not invalidate a problem. This is very important for all the leaders. I'll just give you an example. I had a boss at one point of time in one of the colleges. He was very sweet, he was very nice. The only issue with him was whenever we used to go to him with any problem, he used to say, "Are dude, eta kono problem hi na. This is no problem at all." Now, he actually used to say that to make us feel confident, make us feel less traumatized, less hyper. But there was some employees in his team who started saying that what's the point of going to him? He will never even understand our problem and its intensity. He just rejects the whole problem, trivializes the whole problem. So there we have to change our approach. It may not be a problem to you, but it could be a problem to me. It may not be a problem to you because you're far more able. আপনি অনেকটা পারেন, আমি হয়তো অতটা পারি না, আমি দুর্বল, আমার দ্বারা হয় না, আমার সময় লাগে শেষ করতে। তো আমি যদি এসে বলি, ম্যাম এটা না কিভাবে হবে আমি বুঝতে পারছি না, প্লিজ ডোন্ট সে, আরে দূর, এটা তো কোনো প্রবলেমই না, why are you being so hyper? Let us be a little more patient, particularly now, because we have to understand when we are anxious, when we are depressed, our decision making skills, our cognitive abilities suffer. It might be difficult for us to process information the way we used to earlier. আমরা দেখি না, আমাদের বাড়ির লোকেরা বলে, বাচ্চারা বলে যে আমি ডিস্ট্রাক্টেড থাকলে পড়াশোনায় মন দিতে পারি না। The same thing may happen with us when we are trying to work. So if I'm distracted, if I'm emotionally loaded, if I'm going through emotional crisis, it will be difficult for me to focus. It will be difficult for me to process the information. একবার শুনেই বুঝে ফেলতে পারবো না আমি, আমার আরেকবার শুনতে হতে পারে। তো আমরা অধৈর্য হব না। That is also emotional safety. If the same question is asked thrice, 4 times, I would try to be patient. I understand that organizationally, when we have to meet deadlines, when we have time-related issues, it is not easy. We might have to push the people, but at the same time, let's try. And if I know that somebody is going through a difficult time, আমরা তাকে একটু সাপোর্ট দেব উইথ অ্যানাদার টিম মেম্বার, যাতে কাজটা সময় মতো শেষ হয়, কিন্তু আমাকে ওর উপর পুরো ভরসা করতে না হয়। Let us make some human planning differently. Let us keep a second line planning, because that's also very important. এদেরকে ছাড়া আমার চলবে না, এরা অফিসে না এলে আমার চলে না, এরা বাড়িতে থাকাকালীন সারাক্ষণ অ্যাক্টিভ না থাকলে আমার চলে না। প্লিজ আন্ডারস্ট্যান্ড, এই মোডে আমরা এই প্যান্ডেমিকে কাজ করতে পারবো না। আমার যদি এবিসি কে ছাড়া চলে না হয়, আমার ডিইএফ বানানোর সময় এসেছে। All of them from ABC can be down. I can say that because I'm working in a COVID hospital where, in spite of being vaccinated twice, many of the doctors are down right now. Okay, it's not fatal, but they have to be isolated. So they cannot come to treat at this point. Our OPDs are closed because we do not have enough doctors. We know this is the state also in some other hospitals in our country. So there we have to arrange backups. Maybe the backup would not give me the ideal result. এ থাকলে বেস্ট কাজটা হতো, ফাইন, কিন্তু এখন তো আমরা বেস্ট সিচুয়েশনে নেই। তো আমরা একটু কম বেস্ট সিচুয়েশনে কম বেস্ট কাজ করব, একটু কম বেস্ট রেজাল্ট পাবো, কিন্তু আমাদের সেখানে একে অপরের সাথে একটা হেল্পিং অ্যাটিটিউডে যেতে হবে। একটা নেটওয়ার্কিং এ আসতে হবে, একটা ইমোশনাল সেফটি নেটওয়ার্ক তৈরি করতে হবে around us, that okay, tomorrow if you're unavailable, I would do your work tomorrow. And we know that particularly COVID makes us extremely weak. A friend of mine was telling me that she had viral fever, not even COVID. She was feeling so very weak that she did not even have the energy to kind of lift her head from the pillow. Simple viral fever can create that. So COVID is damaging our health system to that huge extent. At that time, I cannot expect that employee of mine to be constantly sitting in front of the laptop screen. I have to think who can give the backup. So these are some important planning related mechanisms we have to incorporate while working, while functioning. This change management, transition management is extremely important because we become traumatized, hyper whenever a change is introduced. We are resistant to change. And COVID has actually incorporated unplanned change, unpredictable changes. আমি যদি জানি যে আমার ওই এমপ্লয়ি ওই মাস থেকে 3 মাসের জন্য মেটারনিটি লিভে যাবে, ওটা আমার প্ল্যান্ড চেঞ্জ। আমি জানি ওই 3 মাসের জন্য আমি ওকে পাবো না, তার বদলে একে পাবো। কিন্তু কালকেই আমার একজন ভীষণ ঘনিষ্ঠ কলিগ যে আমার সাথে একসাথে টিমে কাজ করে, তার কোভিড ডায়াগনোসড হবে এবং সে ছুটি নিয়ে নেবে কিনা আমি কিন্তু জানি না। তাহলে এটা আনপ্রেডিক্টেবল চেঞ্জ, আনপ্ল্যান্ড চেঞ্জ। তাহলে তার ব্যাকআপ কে? আমি কতদিন তার ব্যাকআপ দিতে পারবো? এই ইনফরমেশনটা আমার একার কাছেই থাকে। আই এম দি অনলি ওয়ান হু ইজ গুড অ্যাট ইট, ইউ ডোন্ট ওয়ারি, আই উইল হ্যান্ডেল ইট, প্লিজ কাম আউট অফ দ্যাট মোড। Do not over centralize your work, please. Create a different team spirit so that if I am unavailable, somebody else has a backup information to at least manage the interim period. Till I am functional, it is my duty to create that second line. If I'm not doing that, then tomorrow if I break, tomorrow if I fall, tomorrow if I'm not available, everything will collapse. The good leadership is not about being indispensable. The good leadership is also about being someone in whose absence the work goes intact. That's also important. Not in his full absence or complete absence, but interim absence. If that is my view. Another important area we have to ensure here, that since safety at accident proneness, etc., labor laws, we have talked about it, I'm sure, in the other sessions, because we are celebrating that in this entire year. We need to know that particularly those works, let's say those who are working with electric supply office, if I'm distracted, I might meet with accidents. So unfortunately, our accident proneness increases when we are emotionally not all right. Our motor functions become jeopardized when we are emotionally distracted. So if I know that somebody is emotionally not keeping well, as a leader, as a team member, as a labor officer, if I know that, I have to probably create some kind of a system where this person can be given a respite. I might have to tell this person, দুদিনের ছুটি নিয়ে নিন আপনি, কারণ এখন যদি আপনি ওই মেশিনটা চালাতে যান গন্ডগোল হতে পারে। Somewhere we have to create that very importantly, because otherwise this person may meet with an accident and then it would become fatal for not only this person, maybe for the entire family. So it is not only COVID. There are other factors we have to keep in mind. You know, if I know that accident proneness, decisional errors, these things might be increased because of emotional trouble, we have to create a different kind of workforce which can work to give a temporary support. One more important thing, when we are working from home, there are certain measures that we can take. The first thing is we feel extremely demotivated. Let's face facts. Today, when I'm holding this webinar from my home, I often feel, you know, not only this, whenever I'm holding webinars, I often feel I wish I could see all these faces. I wish I could see Tapati ma'am, Anindita, Akhi, Vikas, you know, not the names, but the persons, so that we could have interacted. so that we could have had that spirit. But since we can't really create that environment for our own safety, of course, for our health safety, we have to otherwise try to create some kind of an environment for us to feel motivated. How? A, before I sit for work, I have to be somewhat decked up, properly done the way I go to my office. Just because I'm, doing my work from home, some way or the other সকালবেলা কোনো ক্রমে ঘুম থেকে উঠে একটা কোনো রকমে করে বসে পড়লাম করলে না আমরা মোটিভেটেড বোধ করি না। ইমোশনাল রেডিনেস ইজ অলসো ভেরি ইম্পর্টেন্ট। একটু ঠিক ঠিক করে রেডি হয়ে যদি আমরা বসতে পারি, দরকার হলে আমরা যেরকম ওয়ার্ক স্টেশনের পাশে একটা কফির কাপ মাঝে মাঝে রাখি, একটু ঢেলে খাই, create that for yourself. Many of us are not even having separate rooms for ourselves. Maybe there are 5 members, 4 members at the house, and we all have to do our works. বাড়িতে বাচ্চা আছে, তারও হয়তো স্কুল চলছে। Create some corners if possible, যেখানটাতে আমার যদি একটা ইম্পর্টেন্ট মিটিং থাকে, সেই মিটিংটা যদি আমাকে অ্যাটেন্ড করতে হয়, আমি একটু বাকিদের বলে রাখবো ওই একটা ঘন্টা প্লিজ তুমি একটু তোমার যদি একটু মিউট করে রাখতে পারো, or something like that, because I need this corner of mine. Another important thing, you can see the setup here. I have just kept one curtain next to my, at the backdrop. If you think that in my room I do not want everybody to see what are there in my house, at least create a blank backdrop. Because how much you want to convey to your team members about your own personal ground, personal area, that depends on your immediate background planning. This is extremely important for people of our culture who have to share the household with others and work from home, because we get to see the interior of everybody's house in these scenarios. Oh, ম্যামের বাড়িতে একটা নতুন আলো লাগানো হয়েছে, you may not necessarily want others to know that. So create a blank backdrop, just at a curtain রাখুন পেছন দিকে, and then you sit in front of it, because you do not want them to know everything about your household. Of course, it's private. We have to also try to protect privacy, because we are working from our private zone. So these are certain measures that we can try and create. And another very important thing I would say, and after that I would be taking questions from you, we may not have the emotional state of mind to listen to everybody's problems every time. We may not even always be emotionally, physically available for our office all the time, because we have multiple roles to play. In one hand, you're the director of an organization. On the other hand, you're a father or a mother or a child or a daughter. You have multiple roles to play. Or a wife or a partner or somebody's caregiver, multiple roles to play. So there could be moments when you do not want to be available for an organizational meeting, or you know that though this is my working hour, but I at least know that for that half an hour I probably have to serve food to, let's say, my father, because my household person who assists me, my nurse, my maid, is not coming because of COVID situation. So at least tell one of your team members that ওই half an hour না আমি available থাকবো না, আমি তারপরে আবার available থাকবো। এই interpersonal সাপোর্টটা দিন, কারণ আমাদের বাড়িতে অনেকগুলো দায়িত্ব নিতে হচ্ছে। We cannot deny that. If we can provide each other that backup support, we can create a healthy environment. We can pull through together. 2, if you are not in a state of mind to listen to another person's problem, just say that আমারও এখন একটা প্রবলেম চলছে, আমি সেটা নিয়ে খুব ডাউন আছি, তুই কি একটু কদিন হোল্ড করবি বা আরেকটু কারোর সাথে কথা বলবি? At least try and say that. Just do not reject that person entirely, because trust me, we are all going through very difficult time. We are all struggling with existential anxiety. Trust me, the fact that we are all here together, we do not know what will happen tomorrow. And I would take questions from one simple note after finishing this. We are bombarded with existential anxieties, yes, but even prior to COVID, we never knew how and when we will die. This time, death has a particular phase. We are afraid of dying of COVID. But even earlier, we died out of massive heart attacks. We died out of car accidents. we died out of any other, unpredictable events. So death had always been unpredictable. Death can never be predicted. We can never say how long we would survive, when we would die. But till we survive, till we are breathing, let us try to be with each other so that I can go beyond my own immediate pleasure. We have to hold each other's hand to ensure that emotional safe space for everybody around us. Thank you so much. Now, I would just open the platform for questions.
Thank you, ma'am, for enlightening us about the priority of emotional safety, interpersonal trust and harmony, and emotional well-being, which is very much, new concept for us, because we often ignore this. We only look for the physical well-being, but mental well-being is very much important. So if anyone has any question, you are free to ask, because ma'am would be very happy to address those questions. So please, anyone. Anyone who wants to interact?
Yes, ma'am. Your
Hello.
motivational speech,
Hello.
actually, I feel it has helped not only me. I have really enriched with your speech, motivated, inspired rather, to work with my team members in NATMO and outside also. And I hope those who have listened today, they have also inspired. I think your speech will inspire them to work accordingly. What you have suggested, some of the good suggestions we have received today. I think if you are not here, we could have missed you, and that speech what you have delivered. Really, it is inspirational. I thank you very much for your talk. I hope somebody will convey their message or get there some suggestions from ma'am to get more about their idea or questions.
Anyone there who wants to ask questions?
শ্রেয়া
Yes.
হ্যাঁ আমি বলছি ম্যাডাম, আমাদের ভীষণ ভালো লাগলো এবং আমার মনে হয়েছে যে কোভিডের পরিস্থিতিতে আপনার এই লেকচারটা শুধু অফিসে নয়, আমাদের বাড়িতেও আমাদের জন্য ভীষণ কাজে লাগবে। কারণ আমার মনে হচ্ছে আমার বাড়িতেও যারা রয়েছেন, আমার দুটো বাচ্চা, আমার হাজবেন্ড রয়েছে, তারাও কিন্তু ভীষণভাবে মেন্টালি একটা প্রেশারের মধ্যে আছে। এবং আমার মনে হয় আমাদের অফিসে আমাদের ম্যাডাম ডাইরেক্টর থেকে আমাদের একদম জুনিয়র স্টাফ মেম্বাররাও যদি আপনার এই মানে অসাধারণ বক্তব্যটা আমরা মনে মনে অনুভব করতে পারি এবং সেইভাবে নিজেদের কাজে লাগাতে পারি, তাহলে আজকের এই সময় এই উপযুক্ত ভাষণটি ভীষণ দরকারি। অনেক অনেক ধন্যবাদ।
অনেক ধন্যবাদ মৌ আপনাকে। থ্যাংক ইউ সো মাচ ডক্টর ব্যানার্জি, শ্রেয়া। আমার দিক থেকে আমি জাস্ট চেষ্টা করছি আমরা যদি যেভাবে সম্ভব একে অপরের পাশে একটু মনের জোর নিয়ে দাঁড়াতে পারি, কারণ এটা তো আমাদের সবার একটা বড় ক্রাইসিস। এত বড় ক্রাইসিস বোধহয় আমরা জানি না আমাদের কোন প্রজন্ম লাস্ট এক্সপিরিয়েন্স করেছেন আমাদের দেশে। এবং তার পাশাপাশি যেটা আপনি বলছিলেন মৌ, সত্যি কথাই আমাদের তো বাড়ি এবং কাজ দুটোর মধ্যে দিয়েই যেতে হচ্ছে, আমাদের সকলকেই সেটার মধ্যে দিয়ে কোথাও চলতে হচ্ছে, এবং কাজ তো থেমে থাকতে পারে না। সুতরাং কাজের সেফটি এবং আমাদের বাড়ির সেফটি, নিজেদের মন ঠিক রাখা, আমরা যদি নিজেরা মনের দিক থেকে ভালো না থাকি, না আমরা কাজটা করতে পারবো, না অন্য মানুষের মনের যত্ন নিতে পারবো। তাই আমাদের একে অপরের মনের পাশে দাঁড়ানো ছাড়া এই মুহূর্তে খুব বেশি বোধহয় কিছু আর করণীয় নেই। তো আমার কথা যদি কোথাও পৌঁছে থাকে আপনাদের কাছে, আই উড রিয়েলি থ্যাঙ্কফুল। থ্যাংক ইউ।
Surely, ma'am.
Dr. Banerjee, am I audible?
Yes.
Yes, you're audible, ma'am.
Thank you for your excellent speech. We don't know when the pandemic will end. So my question is, how can we strengthen our mental condition in this period? Because every day we are thinking that we are not remembering about the COVID, but it automatically comes.
Absolutely, this is definitely a very difficult time. কারণ যেটা হয় সেটা হচ্ছে যে initially we thought ভ্যাকসিন এসে গেলেই সব প্রবলেমের সমাধান হয়ে যাবে। এবং আমরা অনেকে যারা ভ্যাকসিন নিলাম তারপরে দেখলাম যে কি আমাদের ডাক্তার বন্ধুরা তো ভ্যাকসিন নেওয়ার পরেও ইনফেক্টেড হচ্ছে। কিন্তু আমি এখানে না ভ্যাকসিন নিয়েও একটা কথা একটু বলতে চাইবো, আপনারা অনেকেই হয়তো সেটা জানেনও। এই ভেবে ভ্যাকসিন নেব না করবেন না কিন্তু, কারণ এটাও পরীক্ষিত সত্য যে যারা ভ্যাকসিন নিচ্ছেন তাদের কিন্তু অতটা ফেটাল হচ্ছে না। তাই আমি বলবো যে যেমন অনেক নৈরাশ্যের কথাও হলো, অনেক পেসিমিজমের কথাও হলো, কিছু আশার আলোর দিকও কিন্তু থেকে যাচ্ছে। মানে আমরা কিন্তু কখনোই এটা বলি না যে ফ্লু এর ভ্যাকসিন নিলে আপনার অসুখটা হবে না। অ্যাক্সিডেন্টস উইল হ্যাপেন, ইনজুরিজ উইল নট হ্যাপেন। অর্থাৎ আপনার যদি অসুখটা হয়ও তার ধাক্কাটা অতটা জোরে লাগবে না। তো সুতরাং আপাতত যদি ভ্যাকসিনের ডাক আসে, হ্যাঁ আমাদের মতন দেশে গোটা ভ্যাকসিনের যোগান সবাই কবে পাবে তার তো কিছু কিছু অসুবিধে লিমিটেশনের মধ্যে দিয়ে আমাদের সকলকেই যেতে হবে, আমাদের ধৈর্য ধরতে হবে। কিন্তু যদি ডাক আসে প্লিজ ভ্যাকসিন নেবেন। এবং যেটা আপনি প্রশ্ন করছেন যে আমরা সার্ভাইভ করবো কি করে এই কোভিড পিরিয়ডে, দেখুন আমরা সার্ভাইভ করছি কিন্তু এই মুহূর্তেও যারা আমরা একসাথে এই ওয়েবিনারটাতে আছি উই আর অল সার্ভাইভার্স। আমরা এখন অব্দি সার্ভাইভ করছি। আমার মনে হয় যখন আমাদের বাকি দূরেরটা কিভাবে কি হবে আমরা বুঝতে পারি না, উই হ্যাভ টু টেক ওয়ান ডে অ্যাট আ টাইম। আমার আজকের দিনটায় কি কি করণীয়, আজকের দিনটায় আমার যে কাজগুলো রয়েছে, আমার যে বাড়িতে যেভাবে যেভাবে কিছু প্ল্যানিং করার রয়েছে আমরা কিভাবে করতে পারি। এক্ষুনি অনেক দূরেরটা দেখতে গেলে আমরা আরো ভয় পেয়ে যাব। আর সত্যি কথা যদি বলেন অনেক দূরেরটা কিন্তু কোনোদিনই আমাদের কাছে খুব সত্যি বলা ছিল না, জানা ছিল না। আজকে কোভিড বলে তো নয়, 28শে এপ্রিলটা আমরা হাতে দেখতে পাচ্ছি, এখন 28শে এপ্রিল, এখন দুপুর 1টা 24। কিন্তু 28শে এপ্রিল রাত 1টা 24-এ কি হবে কিন্তু আমিও জানি না, আপনিও জানেন না। তো সুতরাং যদি সেভাবেই আমরা দেখি, এই অনিশ্চয়তা তো আমাদের জীবনের ধর্ম। এই অনিশ্চয়তার মুখোমুখি দাঁড়িয়ে আজ আমরা অসম্ভব আশঙ্কায় রয়েছি, কারণ কোভিড আমাদের সুস্থতা ভালো থাকার উপর একটা বিরাট অন্ধকার তৈরি করেছে। কিন্তু এভাবে যদি ভাবি যে ভবিষ্যতেরটা, কালকের দিনটা, পরশুর দিনটা এক্ষুনি ভাবতে গেলে আমরা এমনিতেও ভয়ই পাবো, আমাদের কাছে কোনো সুরাহা থাকবে না। তার থেকে আজকের দিনটা, এই মুহূর্তে তো আমরা ব্রিথ করছি, একে অপরের সাথে কথা বলছি, একে অপরকে সাহায্য করার চেষ্টা করছি, অন্তত সোশ্যাল মিডিয়ায় খারাপ খবরের পাশাপাশি দেখছি এত মানুষ সুস্থও হয়েছেন, এটাও দেখছি যে কেউ একটা অক্সিজেনের লিড চেয়েছিলেন আরেকজন রেসপন্ড করেছেন। এই পজিটিভ সমন্বয়গুলোকে যদি আমরা একটু আঁকড়ে থাকতে পারি, we do not have much more to say at this point। এইটুকু যদি আমরা অন্তত ট্রাই করতে পারি, কারণ দেখুন আমাদের ভয়ের জায়গা যেটা বা খারাপ লাগার জায়গা যেটা, আমরা অনেক সময় যেটা হয় যে আমরা যখন একটা বিরাট ক্রাইসিস দিয়ে যাই আমাদের মনে হয় ওকে আর 3 দিন এই ক্রাইসিস তারপরে ওভার হয়ে যাবে। কোভিডে যেটা আমাদের সমস্যা আছে সেটা হচ্ছে এই ক্রাইসিসটা লাগাতার চলছে। আমাদের ফার্স্ট ওয়েভ যাওয়ার পরে আমরা কিরকম ভেবেছিলাম যে বাবা ঘাট থেকে নামলো, আবার সে এসেছে ফিরিয়া। আমরা যারা বাংলা দাশুর গল্প পড়েছি বাংলা সাহিত্যে তারা জানি সে আবার সে এসেছে ফিরিয়া করে হই হই করে উপস্থিত হয়েছে। এবং এ তো পাগলা দাশু নয়, এ সাংঘাতিক জিনিস। আমাদের আর না সেই ইন্টারনাল রিসোর্সেস নেই টু ফাইট উইথ ইট। আমরা ক্লান্ত বোধ করছি, which is called pandemic fatigue. We are fatigued। আর কতদিন, আর কি কি ভাবে পিপি পরে ডাক্তাররা ক্লান্ত, তারা বলছে আরে পিপি পরেছি মাস্ক পরেছি তাও তো ইনফেক্টেড হয়ে যাচ্ছি। আমাদের আরো ভয় বাড়ছে, আমাদের তখন মনে হচ্ছে আর কি করে তাহলে নিজেদের সামাল দেব। আপাতত যদি এভাবে আমরা ভাবার চেষ্টা করি যে একদিন না একদিন তো চিকেন পক্সও পৃথিবী থেকে বিদায়, স্মল পক্সও বিদায় নিয়েছিল, হয়তো এটাও ওভাবে থাকবে না, হয়তো এটাও একটা জেনারেল ইনফ্লুয়েন্সার ফ্লু এর মতোই হবে, till we are all vaccinated, till we all go beyond this second wave। ইউকে তে সেকেন্ড ওয়েভ ওরা কাটিয়ে ফেলেছে, আচ্ছা আমরাও তাহলে হয়তো কাটিয়ে ফেলবো। একটু সেদিকটার দিকেও যদি আমরা তাকাতে পারি ফর দ্য টাইম।
Thank you, ma'am. Thank you for inspiring us. And we take oath today to hold our hands together and to be there for everyone, and the walk must go on. Thank you for your valuable time, sparing us for the valuable time in your busy schedule. And we are very happy to have you with us. I sincerely thank our respected director, madam, for giving us this platform. I would like to thank Cisco and DST Government of India for their continuous support. And I would also thank all the dignitaries and NATMO officers and staff members for being a part of this occasion. And we will meet again in the next webinar very soon. Now I request everyone to stand up for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all. Thank you.